Good afternoon, and welcome to Black Health, a talk show addressing health issues that impact the Black community. And I'm so excited to be coming to you live today from Florida Memorial University, where the Health Foundation of South Florida is sponsoring the second annual Black Health Summit.
She came back really agitated because they had said, oh, you have all those children, where's this one going to see? That's not nice. And she said, I went to her, I held her hand, I looked her in the eye, and I said it was okay.
Good afternoon, and welcome to Black Health, a talk show addressing health issues that impact the Black community. I am your host, Dr. Michelle Kirwan Bythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. And I'm so excited to be coming to you live today from Florida Memorial University, where the Health Foundation of South Florida is sponsoring the second annual Black Health Summit. There are 3 areas of focus for today's Black Health Summit, and those are maternal fetal health, housing, race, and climate, and toxic stress and healing. We have amazing speakers coming from local universities and hospitals, and we have amazing speakers that are coming from national institutions. So stay tuned for more on Black Health today here at the Black Health Summit at Florida Memorial University. Welcome, Ms. Linda Villarosa, to Black Health. It's a pleasure to have you today.
Thank you. It's wonderful to be here.
Thank you. I'm going to first introduce you. Linda Villarosa is a contributing writer for the New York Times Magazine, where she covers race, inequality, and health. She is a former executive editor at Essence Magazine. Last year, she published the critically acclaimed Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation. It was featured in the Atlantic's most thought-provoking books of 2022 and also a finalist for the Pulitzer Prize this year. Congratulations on those accomplishments.
Thank you.
I want to start by traveling back a little bit in time to 1985, when the U.S. Department of Health and Human Services released a 239-page report called the Heckler Report. And you speak about this in your book. And you said that this was the first report of its kind that studied the health status of people of color. What was the result of that Heckler Report, and what action did the government take, if any?
Well, it was really eye-opening for the first time we knew about racial health disparities, but had never seen it quantified, especially in a governmental report. But unfortunately, the resources weren't put into it. It was sort of like, I remember the response at the time was kind of like, well, we see there's all these problems, but people of color, especially Black people, just take care of yourselves. And so it was good to have the document, but not good that was the outcome.
So we're almost 40 years later now, and one of the panels today is on maternal fetal health. Almost 40 years later, Black women die more than white women during childbirth. Black babies die more than white babies in childbirth in the first year of life. In a country as wealthy as the United States and with the advanced technology that we have, why are we failing Black women and babies? Is this to do with education, lack of education, poverty, access to healthcare, genetics, or is there something deeper?
I think the thought used to be every single thing you said: poverty, lack of access to healthcare, lack of education. But now we know from a statistic that really still strikes me that a Black birthing person with a college education, a master's degree or higher, is more likely to die as the result of having a baby or the time after than a white woman with an 8th grade education. So that says that it is beyond just not us knowing enough. We've long ago proven that it's not something wrong with our bodies, and that this problem is not race per se, but how you're treated, which is racism.
Yeah. You spoke earlier in your keynote feature today about your work with the 1619 Project, and you talked about medical myths. What are some of these myths and where did they originate?
The medical myth that is probably the most important to us now is the false idea that we are immune as Black people to pain. And that came from centuries ago, and it was used to justify the worst kind of treatment, emotionally and physically, of enslaved people. And it was justified because many of the people who were doctors and scientists were pushing it because they owned people. And so they had skin in the game. And then the through line to today is that myth still is hanging around in medicine, in healthcare, in medical education and training. And the only way to sort of get rid of it is to confront it, and also to have physicians, medical students, nurses, everyone who works in the healthcare system to be trained in some kind of implicit bias training.
Very good. Ms. Linda Villarosa, thank you so much for joining us on Black Health. It is truly an honor interviewing you and speaking with you and hearing your keynote address today. It's been a pleasure. Thank you so much.
Thank you for your work as a doctor. We need you, and we support you, and we care about you.
Thank you. Thank you very much. Hello, Dr. Adams, and welcome to Black Health. Thank you for joining us today.
Dr. Kirwan, it's always a pleasure to be with you. Your presence just makes everything better.
Thank you so much. And actually, I should be saying welcome back to Black Health, because
That's
you
right.
have been on the show once before.
Absolutely.
But before we get started, I'm going to do a quick introduction. Dr. Nelson Adams is a board-certified obstetrician gynecologist. He was the first African-American chairman of the Department of Obstetrics and Gynecology and the first African-American chief of staff at the North Shore Medical Center. In 1992, he founded the Maternal Child Health Initiative. And that actually leads me to my first question. Dr. Adams, what is the Maternal Child Health Initiative?
Well, it's an initiative that started a long time ago, 1992 it was, and it was formed because there were a number of patients who would just show up at the hospital having had no prenatal care. At that time, there were many hospitals that really were not particularly receptive to patients who had Medicaid. And we decided to get some docs and some nurses together who would see those patients so that the patients would at least have a medical home, if you will. And it was a bio-psycho social model where we took care of many of their needs. Many of them had social needs, and we talk now about the social determinants of health. We were trying to address that back then. We recognized mental health was a huge component, so the psychological aspects were being addressed by a clinical psychologist, and then the physicians and nurses took care of the physical needs.
Wonderful. So today you served as a moderator, and you were also here in terms of the maternal fetal health disparities that we are seeing in this country. In your experience, what are some of the key factors contributing to racial disparities in maternal fetal health outcomes?
Wow, that's a big question, and it's so ingrained in almost everything that we do and experience. It is not so much the individual's heart. It's not so much that folk are going out of their way to be racist or to discriminate. It's just that the system has sort of set some things up such that it seems to be the right thing to do. I'll give you an example. I'm obviously of African descent. I'm a Black man. During my residency training, I was trained just like all the other residents that if a young Black woman came to the emergency room with pelvic pain, you should assume that the diagnosis was going to be pelvic inflammatory disease, a sexually transmitted disease, if you will. If it were a young white woman who came with the very same symptoms, the assumption was that she had endometriosis. That carried on for folks who were trained, regardless of your background. That was the way you were trained. And so that became systemic. And so systemic racism is alive and well even today. Uh, and I'm not naive enough to think that there are some folk who really are racist, but I think to a greater degree, it's the systems that we have to work with so that when we talk about policies and procedures, when we think about elected officials, we see some things even in the state of Florida that are changing. It seems earlier I shared with the group that on some things, the more things change, the more they stay the same. In fact, unfortunately, it looks like sometimes if we take one step forward, we take two steps back, and that concerns us. We see that in all aspects of life, but certainly as it relates to our health. And when you've got your health, you've got just about everything. That's your physical health, your mental health, your financial health, your environmental health, your spiritual health.
Are there specific challenges or barriers that disproportionately affect pregnant individuals from marginalized racial or ethnic backgrounds, and how do they impact maternal health outcomes?
I think healthcare, I like to refer to the 3 A's, if you will. Healthcare must be available, it must be affordable, and it must be accessible. There are some communities where it's just not available. You go to some rural communities and some urban areas where there just is not health care. I like to encourage folk to always strive to be the best version of themselves that they can be. And I generally close, most times I have an opportunity to speak or be interviewed, reminding the audience to be the best version of themselves, and I encourage them this way.
Bring it home, Dr. Adams, bring it home.
Got to do it. It's just a must.
I love it.
In all that we say and all that we do, we've got to be and do our best. Remember it this way. Good, better, best, never ever let it rest. Not until your good, my good, our good becomes our better, and our better becomes our best.
Amen.
Amen.
Dr. Adams, always a pleasure to speak with you, to see you, to interview. Thank you so much again for being here on Black Health. You continue to be an inspiration to the community, an inspiration to physicians, young and old, and an inspiration to me. Thank you for all that you do and continue to do. I know you're not done.
Not done. Yeah.
I think you've gotten to your best, Dr. Adams, but I don't know. You be. So thank you again. Absolutely. Thank you. You are watching Black Health, and we are going to take a quick commercial break. Stay tuned for more at the Black Health Summit at Florida Memorial University in Miami Gardens, Florida.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Us a call.
When quality care is a priority.
Welcome back to Black Health. We are broadcasting live today from Florida Memorial University, where we are in attendance at the 2nd Annual Black Health Summit.
We're the primary healthcare providers for pregnancy, birth, and postpartum since forever.
We cannot count on the youth to guide us into the future. We have to go with them.
About 12% of persons of color will be diagnosed with type 2 diabetes.
And I give myself permission to love on myself in this moment.
We want to hear from you. We value your input because we are all in this together. Good, better, best. Look, man, that was real weak. Give it up. Yeah, maybe you should stand up. Stand up. Good, better, best. Come on. Let it rest. Not until my good, your good, our good becomes our better, and our better becomes our best. Thank you all so very much.
Welcome back to Black Health. We are here now with Dr. Roger Mitchell. He is the chair of pathology at Howard University School of Medicine, correct?
Yes,
Medical
yes,
school?
yes.
I get that right?
Yes, you got it right. Thank
Very
you so much.
good. Welcome.
great to
And
be here.
you are here today on the toxic stress and healing panel. Is that correct?
That's right. That's right. We're trying to give all the participants an opportunity to understand stress levels and how inappropriate stress can lead to bad outcomes in the form of violence, trying to give them the tools to take back to their particular communities to deal with toxic stress, but also violence as a public health issue.
So you are a forensic pathologist, correct?
I am a forensic pathologist.
Tell us a little bit about what a forensic pathologist does.
Well, pathology is the study of disease. As you know, as a physician, we all had to take that second year
we did.
pathology course that we dreaded.
Yes.
But now in College of Medicine, I teach that second year course. So
You're on the other side.
I'm on the other side.
made it.
Yeah. And so forensics is functionally the type of pathology that may be debated in a court of law. Right.
Okay.
And so those are around deaths that may be accidental, homicides, suicides, or undetermined. And so I've been a forensic pathologist since about 2007, served all over the country and actually teach forensic pathology globally now.
Okay. Wow. Impressive. So you are going to be speaking today about violence prevention, correct?
Yes.
Tell us a little bit about the main points that you hope to get across today to the attendees.
Yeah. I mean, I think the big thing about violence and looking at violence for the purposes of identifying solutions is looking at it through the public health lens. W.E.B. Du Bois talks about the 5 areas of policy, which is education, economics, housing, healthcare, and criminal justice practices. If we add one more, it would be environmental justice, because we know environment plays a huge part in how our young people are growing up. But equitable access in these areas, we might be talking about it as social determinants of health. Equitable access to these areas actually prevents violence, because violence, just like any other disease, requires an environment so that it doesn't occur. So we want people to leave that session understanding their own toxic stress, right? Understanding their own ability to decompress, and the importance of anti-stress activities, but also how do we develop policy and programs in community that also will decrease violence, and those happen through the development of access.
And are we developing policies that can help in this area?
Well, we are. I mean, there's movements, there's national movements. I'm from Washington, D.C., and while I was there, I was the chief medical examiner for D.C. for about 7 years. And at the end of my term, I actually served as deputy mayor for public safety and justice. So I had the unique role of being a physician, also in charge of police, fire, prisons, the whole thing. And we developed a pretty good public health approach, funded fully by the mayor, institutionalized within government, that provides support for not only violence interrupters, but behavioral health support within law enforcement. So there's a lot of best practices out there. We just, it happens at the local government level. Now there's some national government moves, there's support. There's some research that's out there right now, research dollars for the first time in about 28 years. There's research dollars in gun violence. So there's some policies that are working, but it's in its infancy.
Your panel touches on climate also. Talk to us a little bit on how you see climate affecting Black communities, climate change.
Well, where we live is extremely important. And we know that if we take a census of where our dumps are, where our where our bus depots are, there's poor water quality.
Yes.
Those happen to be right.
Just
Happen to be
randomly.
but no, directly in communities of color and poor
absolutely.
communities across this country. And so we have to take stock of all of the environment that we're in and really tear down the structures of institutional racism wherever they lie. And environmental justice is a place where we have a great opportunity to do so.
Excellent. Any last parting words for the audience watching here on Black Health today?
Well, congratulations on Black Health. I hear not too long ago you were a virtual environment. Now you're big time, and it's important to have these voices and these faces talking about healthcare delivery. And so I would just tell your viewers to look at violence as a public health issue, to advocate in their communities, at their local county, at their local state, their local town, municipalities, to get programming in to support young people, because that's where it starts.
Yeah, and to get out and vote.
That's right.
Yes, absolutely. Well, thank you, Dr. Mitchell. It's a pleasure having you on Black Health today. I look forward to seeing you on your panel this afternoon.
It's my pleasure.
All
Thank
right,
you.
take care. Thank you. And you are here with Black Health, and we are going to now speak with Laureen Chant, the president and CEO of the Health Foundation of South Florida. Welcome to Black Health. Thank you for being here.
Thank you so much for having me. It's great to be here.
Absolutely. We're going to dive right in.
Perfect.
Can you provide an overview of the Health Foundation of South Florida's mission? Yes, it is. And the key areas of focus for your organization.
Happy to do it. So the Health Foundation of South Florida was founded actually 30 years ago. We are a funder. Our mission is to reduce disparities and invest in the health and well-being of our community, particularly vulnerable and underserved communities. And we do that by focusing on three core areas primarily. One is around access to health, understanding that providing access to high-quality health care and meeting the health needs of the population is really a critical component to getting to health and well-being. The second piece, which really the Black Health Summit speaks so deeply to, is identifying ways to address the social needs that are impacting the health of our community by bringing together the healthcare system and the community-based organizations and others, so who are really in the position of working together to address the social needs that we know are affecting health and well-being. And then the last, which is really challenging for all of us, and something a lot of people work on, is really looking to address community conditions and rising and creating thriving communities, addressing economic disparities and opportunity, educational opportunities, and the kinds of things that ultimately lead to a community's overall health. So those are our three areas of focus. And since our inception 30 years ago, we've invested more than $140 million in organizations and leaders in this community.
Wow.
Yeah, we've
Very
been busy.
impressive. You've been very busy. How does the foundation support and promote community health initiatives in Miami, particularly in underserved communities? I guess with your dollars.
Yeah, well, actually, and it's really interesting because that's funders, and obviously we know that dollars are needed. But beyond that, when we're trying to get to systems and solutions, we see our role as a convener, a collaborator, and a partner with the organizations that are doing the work. So maybe a really good example is recently we announced, and we announced today at the Black Health Summit, we convened and we called out and we said we would like to create and support and fund health equity collaboratives, bringing together the health systems, the community-based organizations, the payer population, and really bring them together. We worked with them for over 3 months to come up with solutions that made sense to address the disparities affecting the Black community. We called out specifically Black maternal health, which we know the very poor outcomes in that space, chronic disease management, and access to health. So we actually, yes, we're a funder, and ultimately I know I announced this morning that we invested more than $2.4 million in that effort already. But beyond that, what I hear from the people that were at the table is, beyond our dollars, bringing them together, nurturing the relationships, helping these organizations to think through the right solutions and bringing the right partners to the table, that made it even more powerful. So we're pretty excited about that.
Well, thank you, Ms. Chan, for being here on Black Health today. We appreciate it. We appreciate all that the Health Foundation of South Florida does for South Florida. I know many organizations that have received funding from you all, including the one that I work for, the Center for Family and Child Enrichment here in Miami Gardens. So we thank you for all that you do as the president and CEO of the organization.
Thank you for what you do.
Absolutely. Absolutely. I wouldn't have been anywhere. This was a very exciting, and I can see the improvement from last year's, and I can only imagine that year after year it's just going to get bigger and better. So I'm really looking forward to it. Absolutely. It will. You can feel the excitement in the room and how everybody is just, reinvigorated to really dive into what we can do about racial health disparities and not just health disparities in housing and stress and everything else. So again, thank you very much for being here on Black Health.
All right, you take care.
Thank you. And again, you are here with Black Health today at Florida Memorial University at the Black Health Summit, the second annual Black Health Summit. What an amazing day today. What amazing guests that we had to interview today. I'm so very excited about the future of the Black Health Summit and all that will come out of it. And I look forward to seeing you again next time on Black Health.